So you want to learn about chicken anatomy? Let's go.
Step 1. Catch the chicken. Now for step 2 and 2A. First, have a certified professional gas the chicken. But then you gotta double check that your chicken is actually dead.
Dr. Giles.
Step 3. Prior to dissection, check it out. Locate the external anatomy. Combs and wattles are structures that vary in size and shape among avian species as well as among strains of chickens. Size and color are also dependent on sex hormones. Purpose is most likely ornamental. The earlobe is the modification of skins located below the opening of the ear. The color of the earlobe is highly correlated with the color of eggs. The brachial vein is a large vein under the wing used for blood collection. The vein is seen lying in the depression between the biceps brachialis and triceps humerales muscles. The uropygial gland, also known as the preen gland, is a large bilobed sebaceous gland located dorsally at the base of the tail. It secretes oil, which can be distributed throughout feathers of birds by preening behavior.
These are the primary feathers. This is the axial feather, which separates the primary feathers from the secondary feathers.
Step 4. Try to fly. The birds use the pectoralis major when they fly.
I believe I can fly. I believe I can touch the sky. I think about it every night and day. Spread my wings and fly away.
Here, in the wing, the biceps brachii is a flexor of the wing running ventral to the humerus. The two heads originate near the glenoid fossa, which is the shoulder joint, and the proximal end of the humerus. It inserts at the proximal anterior surface of the radius. The triceps brachii flexes the shoulder and extends the forearm. Two heads originate from the scapula and the proximal humerus. Then it inserts at the olecranon process of the proximal ulna. Next we have the deltoideus, a sheet-like muscle covering the dorsal shoulder originating at the proximal clavicle and inserting at the deltoid tuberosity of the proximal humerus. The muscle flexes the shoulder and rotates that wing outward. You now have the medial side of the leg. You have the semimembranosus, which extends the thigh and flexes the knee. It originates on the lateral surface of the ischium and inserts on the caudal surface of the tibiotarsus. Next, you have the quadriceps femoris. It's observed from the medial side view and lying posterior to the sartorius. It originates at the ilium and inserts at the patellar ligament, which means it extends the thigh. You also have the ambiens. It originates on the ilium and the pubis and inserts on the proximal tibiotarsus. Lastly, you have the adductor longus. It adducts and extends the thigh. It originates at the ventral border of the ilium and pubis and inserts at the distal femur. Now for the lateral part of the upper leg. You have the iliotibialis, which is also the gluteus maximus. It's a sheet-like muscle covering of most of the thigh. It originates at the pelvis and inserts at the proximal tibia and at the patellar ligament. It flexes the hip and extends the knee and lower leg. You also have the sartorius, a long thin band at the anterior border of the thigh. It flexes the hip and extends the knee. Originates at the lumbosacral area and inserts at the patellar ligament. Next you have the semitendinosus, which extends the thigh and originates at the ilium and ischium. Inserts on the caudal femur. Now we have the lower part of the leg. This includes the gastrocnemius, which flexes the knee and extends the foot. The three heads originate from the distal femur and proximal tibiotarsus, and it inserts at the tuber calcaneae. And then you have the tibialis anterior, which flexes the tarsometatarsus forward. Now for the upper part of the bird. You have the M superficial pectoral This is the largest muscle of the bird, and it contributes most of the force necessary for the downward movement of the wing. Its origin is at the sternum, the furcula, and the sternal ribs, and then it inserts at the ventral surface of the humerus. You also have the supracoracoideus, which is the pectoralis minor, and it lies deep in the M. pectoralis major and is responsible for the elevation of the wing in the upstroke. Origin is at the sternum, furcula, and the sternal ribs, and then it inserts on the proximal dorsal surface.
Step 5. When the mommy chicken and the daddy chicken love each other very much.
Large yellow follicles are arranged in a hierarchy of size. The largest follicle will be the next to ovulate and is called the F1. The next largest follicle is termed the F2 and will normally ovulate the following day. Small yellow follicles will continue to grow and replace the hierarchy of large yellow follicles as they ovulate. The small white follicles will replace the small yellow follicles. The infundibulum is the portion of the oviduct that catches the oocyte after ovulation and directs it into the magnum of the oviduct. The infundibulum is one of two sites for sperm storage in avian species. The magnum is the thick-walled part of the oviduct with glands that produce and secrete albumin and other proteins that contribute to the egg. The oocyte stays in the magnum for about 2 hours. The isthmus is caudal to the magnum and thinner-walled where the egg membrane is formed. The oocyte remains about 1 to 2 hours in the isthmus. The shell gland, or the uterus, is the site of shell formation and pigmentation. The process takes approximately 20 hours. The oocyte then moves to the vagina, the segment of the oviduct between the shell gland and the cloaca. Sperm are stored in tubal glands at the junction between the vagina and the shell gland. The next photo shows the inside of the isthmus and the magnum. As you can see, the inside of the magnum is obviously glandular, while the inside of the isthmus is much smoother. The male reproductive system is relatively simple. The seminal vesicles and prostate are absent. The phallus is small and has associated lymph glands producing a fluid which is added to the semen. The sperm after mating is stored in folds of the oviduct by the hen. Good fertility may be obtained for as long as 6 days after insemination. Shown here is the testes on the inside of the body cavity. Shown here is the entire male reproductive system, including the testes and the vas deferens, which is the duct that conveys sperm from the testicle to the urethra.
6. Cue hunger contractions.
Gurgle, gurgle.
The digestive tract starts at the mouth, which is the site of prehension. In chickens, the mouth has no lips nor teeth. Outside of the mouth and oral cavity is the beak. The beak crushes, tears, or holds on to food. The tongue is a narrow and typically triangular organ, which contains few taste buds, but the tongue has various touch receptors. Birds are known to distinguish food by touching and feeling it. Small amount of muscles around the tongue of the chicken. The esophagus is a tube surrounded by smooth muscle that runs perpendicular to the trachea. The esophagus is also mostly dorsal to the trachea. The crop temporarily stores food. The proventriculus is the glandular stomach location that secretes hydrochloric acid to keep the pH within the range of 0.7 to 2.3. This is the location of peptic enzymes and mucus for digestion. The gizzard is surrounded by thick muscular walls with a sandpaper-like inside. Muscles around the gizzard provide strong contractions. The presence of grits provide mechanical digestion and mixed food, especially hard materials like small stones. The small intestine is made up of 3 parts: the duodenum, the jejunum, and ileum. The jejunum and ileum are posterior to the duodenum. The mesentery keeps the small intestines attached to the dorsal abdominal wall and supports the superior and inferior mesenteric arteries and veins within this tissue. The primary function of the small intestine is nutrients absorption. The pancreas is found within the duodenum loop of the small intestine. The pancreas is an exocrine and endocrine gland, and its bile duct leads into the duodenum of the small intestine. The intestinal ceca is populated by bacteria that digest plant cellulose. This is also the location of water reabsorption. The liver is a large gland with 4 lobes found in the abdomen. The coronary ligament attached the liver to the pericardium and the falciform ligament fixes the ventral surface of the liver to the ventral body wall. The gallbladder is the organ of bile storage. The gallbladder discharges bile into the duodenum to facilitate lipid digestion. The large intestines is another continuation of water absorption. And lastly, the cloaca is where all the fecal matter from the intestines end up, and the fecal matter is ejected from the cloaca through the vent.
Oh, sorry. Step 7. Take a deep breath.
Chickens don't breathe the same way that humans do. They have a trachea that connects the two symmetrical lungs, which lead to parabronchi, which are continuous tubes allowing air to pass through the lung in one direction. These are laced with blood capillaries, and it is here that gas exchange occurs. The trachea is made up of cartilaginous rings that prevent its collapse from the negative pressure caused by inspiration of air. The syrinx is the voice box. The chicken voice is produced by air pressure on a sound valve and modified by muscle tension.
Step 8.
Oh, God.
Gotta pee.
In the chicken, the kidney is a 3-lobed structure. It's found in the bony cavities formed by the ileum and the sacrum of the pelvis. Then there is the ureter. It's a tubule emerging between the most cranial and middle lobe of the kidneys that run parallel to the abdominal aorta and terminate in the cloaca.
Step 9. Lub dub, lub dub.
Avian species have a 4-chambered heart that is enclosed in a pericardial sac. It's very similar to a mammalian heart, and it has the right atrium, right ventricle, as well as the left atrium and left ventricle.
Don't touch me, I'm sterile.
Oh, sorry. Step 7.